Good morning, everyone. It is Tuesday, January 18th. Welcome to the Morning Medical Update. Thank you so much for joining us here on Facebook and on YouTube. Thousands more cases of COVID on both sides of the state line, and Chief Medical Officer Steve Stites is going to help us break down how that is impacting the already dire hospital situation that we have been seeing. We are also going to be joined again by Dr. Amber Schmidtke. She is the Chair, Division of Health Sciences and Mathematics at the University of St. Mary. She's our numbers gal, and she has some new information for us and what it will mean to us here in our area. Healthcare providers and staff in the metro and across the state are feeling the burnout. We are also going to be joined by Dr. Brian Holmes. He is in Abilene, Kansas, to talk about the impact COVID is having on small communities there and how transferring sick patients to bigger hospitals for care has continued to be a major problem in those areas. So please make sure you get your questions sent in to us on YouTube, Facebook, and email them right there to the Medical News Network. You can find links right there on your screen. Before we get to COVID numbers today, the Jackson County Legislature is deciding today if it will implement a face mask mandate for students K through 12. If it is approved, it would apply to schools outside the Kansas City metro, which already has one, and the city of Independence, which we are now just learning they did just reinstate their universal masking policy. Other schools like Olathe, Kansas City, Kansas, and St. Joseph, Missouri are canceling classes today and tomorrow. There is also talk that other metro area school districts could follow suit as early as today. And starting today, you will also be required to wear a face mask indoors in Mission, Prairie Village, and Roland Park, Kansas. That will be at stores and restaurants and retail spaces. That ordinance will expire next month. All right, we do want to get to our COVID count this morning. Medical Director of Infection Prevention and Control, Dr. Dana Hawkinson, is joining with us with our numbers today. Good morning to you.
Hi, how are you?
Hi.
So we have 126 active infections, 28 patients in the ICU, and again, continues to be a large proportion on the ventilators. We have 18 of those on the ventilator, still 73 in that recovery period. And overall, we have had from the 14th to the 17th, we had 5 inpatient deaths, but overall for January 2022, we've had 26 inpatient deaths. So quite a bit more than we have in past months.
Yeah, this is one of our heavier months for inpatient deaths, which should not surprise us because it's one of our, we set new records for COVID admissions and COVID hospitalizations. And I think what we're seeing is what we're seeing across the country, which is that the Omicron, we think we had a twindemic here. We had the Delta variant leading to a lot of hospitalizations, and on the heels of that, the spike in Omicron, which has created so much of the problem, I think, in our community, and one of the reasons schools can't stay open and businesses are challenged and supply chain is challenged. There just aren't enough folks to work, and we know that that's true in the schools, right? We've heard repeatedly that teachers there aren't enough teachers to teach. The administrators, the principals are trying to teach classes. There's nobody to patrol the hallways. I mean, it's just a struggle when you have so many people who are out with Omicron. And we've seen that in our own hospital where we've had a lot of people out. Fortunately, those numbers have come down a little bit, but the COVID numbers continue to rise. And I think should not surprise us because we know that hospitalizations lag behind the case counts by a couple, 3, 4 weeks or 2 to 4 weeks, and we're seeing our overall hospitalization numbers continuing to go up. We set a new record now for the highest number of hospitalizations that we've had in the acute phase. What's interesting is they appear to be a little younger, by 3 to 4 or 5 years younger, and the length of stay tends to be about 2 to 3 days less than what it was last time in our largest peak. And so I think we're beginning to shift from Delta into an Omicron phase here in our hospital. Unfortunately, we don't do genomic testing, so we can't know exactly. I want to applaud those areas that are going back to mask mandates. You want to keep things open. Again, people talk about freedom, and the reality is when you're in the midst of a pandemic with a highly transmissible variant, if you're going to keep schools open, if you're going to keep businesses open, you got a choice. If you choose not to mask and people are indoors, you're not going to be able to stay open. If you mask, you'll be able to stay open. It's pretty simple math, yes or no. It's kind of binary.
Well, I'm a heartbroken mom this morning as both my kids will be not learning. They'll be sitting at home, no online, nothing. So it's starting to get real for people in different ways.
It is, and it's funny why it takes so long. We try to sound the horn a lot, and but I think the schools are beginning to impact, and people say, "Oh gosh, this really is real." And the problem is a lot of people are sick. Hospitals are really busy. We hear a lot about crisis standards of care. We've not had crisis standards of care here at KU. crisis standards of care is when you're making decisions to let someone die who otherwise you might have been able to help because you don't have enough resources to do that. Or you might say, I've got two folks, I'm going to be able to take care of the one who I think I have the best chance of helping and not the one who you may not. Or you may say, okay, I'm going to take care of the young folks and not the older folks. And unfortunately, I'm starting to fall into that latter category. So I don't want to see crisis standards of care.
Right.
But I think that the reality is, I mean, we're not a crisis standards of care at KU. And I think throughout the state we have veered right up to it. And you hear about it in Idaho and Nebraska, and you may edge into it for a brief period of time, and then you're able to get enough staffing that you can get it back right again. You hear it with ambulances and saying, well, we don't have enough staff to transport all the sick people, so we're only going to transport the ones we can really help. I mean, that's the state of our nation because of this variant that we're faced with, and because we've really refused, and from a national perspective, to take responsibility by doing the one thing we know, or the two things that we know will really help in the pandemic. One, to get vaccinated and boosted, and to wear a mask. And those two things would really reduce the risk of the crisis standards of care dramatically.
I know. Did you have something
I was just going to say, and we know we hear these things on the news every day from prominent people, their opinion that some of these mitigation strategies don't work and that the virus continues to run through. But we have to understand a lot of these mitigation strategies have been actually shown and proven through peer-reviewed studies to be effective. And it's not just one, but it's a combination of all these to help stop the spread and help stop the disease.
I mean, it's remarkable. I mean, I guess we could ask, tennis, anyone?
Right.
But just kidding. But the truth is that we do face a challenging time, and what we ought to do is just face it head on with truth and not with the non-truths that keep getting spouted. And it's hard to have a real conversation about policy, about healthcare policy, and about healthcare when people want to keep putting stuff that's just not true out there.
We only have you a few moments.
Yeah, I got to go to
today.
8:25. I got to go join. You got me for another 10, 15 minutes. You're stuck.
Okay, I'm going to use you all up because we've got a few reporter questions, I think, on the line. But I want to ask, because Fox 4 is asking, it has been reported that COVID cases are coming back down in places like Boston and New York. When do you think Missouri and Kansas will start to see a decrease?
Yeah, we'll hear of that from our mathematician in just a minute. But we've heard various estimates. I'd say sometimes within the next 1 to 2 weeks we'll see a drop in numbers. Now we saw a drop over the holiday weekend, but people don't report as well, so that doesn't count. And the reality is we have to still track where we are today. But I think there's a two-phase question. One, new tests that are positive in the community, that's one question. Remember, there are a lot of tests being done at home, and there are a lot of people who aren't getting symptoms. So when we say right now the number of people who are positive are about 500% higher than the peak last winter and fall, which is about right nationally. And the number of hospitalizations currently are running about 300 to 400% of the peak before. So highest numbers of hospitalizations nationally, highest number of new cases, locally the highest number of new cases and the highest number of hospitalizations. I'm going to guess that toward the end of this week we'll start seeing it. We'll see a blunting of that peak, and then hopefully we'll see it start to turn down. I think hospitalizations are still delayed.
Dr. Amber Schmidtke, jump in on this one.
Yeah, good morning. It's great to be with you. So when it comes to when we might peak, one of the earliest indicators we might have is what's going on with wastewater surveillance for the virus. And right now, because of the holiday weekend, we aren't getting reliable data right now for the Kansas City Metro. But when it was robustly running last week, it did not appear to be peaking. And so those trends tend to predate the case trend by about a week. So we probably are, we're in sort of a weird spot right now, like Dr. Stites said, because of weird weekend reporting that happens. So we'll just have to see. I can say in other parts of the country, that's one of the indicators that we've seen for Boston. Like you mentioned earlier, wastewater surveillance has predicted when the peak was coming. And so we're hoping that, when data becomes more reliable on the Missouri side of the river, then we will have a better prediction of when the peak might happen.
Have you seen any of the Kansas data either? Because I know the Kansas data, it's scarce. It's a little scarce sometimes to try and follow on the reporting side.
It is, and especially when it comes to wastewater surveillance. To my knowledge, the only city that's doing that is the city of Lawrence. And obviously, Kansas is a much bigger state than just the city of Lawrence. So we don't have the information that would be helpful in that case. Instead, we are really just limited to the metrics we've been following this whole time, things like testing, cases, hospitalizations, et cetera.
And KDHE does have that. At least I know historically when Lee Norman had made some comments about it, he would have that wastewater testing. So I don't know where it is today. It's a little harder to discern.
Other reporters on the line today.
Hi, guys. Good morning. It's Taylor at 41.
Hey, Taylor.
Question about tomorrow, as you likely know, is when the line opens up to start ordering at-home tests from the federal government. That website is set to open tonight, and people are going to be able to start ordering their at-home tests. Two questions. One, have you heard anything about what we know about the efficacy of these tests? We've talked about how effective or ineffective some at-home tests are, and a lot we've heard you say in some cases if you get a negative test on an at-home test, still maybe worth checking out, getting a different test. Do we know anything about the efficacy of these at-home tests that will be available? And what would you say about best practices for a family as far as when they should order them, how they should use them, that kind of thing?
Yeah, I know it's the Binax Now test,
Yeah.
which is a good test and one of the best used tools, and the one I think that when we did actually a lot of studies here on Chad Cannon, we could have him come back sometime, the head of the ED. They were the leading enrollment site for the Binax Now test in the United States. So they've done a great job. I think it's a good test.
Yeah, I think it is. There is a preprint, so non-peer-reviewed at this point, about the Binax done out of UCSF out in San Francisco, looking at that and looking at those people who are PCR positive, and it showed that the Binax Tau did have really good sensitivity, so it's able to pick up disease if it was there, if you had a cycle threshold or a PCR value of 30 or less at probably about 95%. So it went down a little bit, but that may also correlate with your ability to infect others as well. So it does have very good sensitivity. The bottom line is that it does have very good sensitivity overall. If you are have been exposed and you are having symptoms, the other thing you want to do is maybe test a day or two later as well, because those viral dynamics in your body, you may not be replicating enough at that point to have detection and be infectious, but it would be important to maybe test a day or two later to see if it's positive. But overall, it should be fairly sensitive to pick up disease.
I do think it matters. Do you think it matters if you're vaccinated and if it's the Omicron variant, how well it picks up, Hawk?
I think in the initial few days, it probably does not. You are still probably replicating fairly high levels, but as the days go off, say after 5 or 6 days, you should have significantly less viral load at that point, or antigen load to detect on those home tests.
Yeah, I think this one that they've ordered, I think this is a good one, and I think it'll, a lot of it still it can be used or error, et cetera. But I think a positive test is positive, a negative test may be negative. You're not sure what we call the negative predictive value, whether that's really how good that is. And then the other question is around which test you have, because a lot of people still get them at the drugstore or where else. That's where I got mine at home, and we had a wedding over the weekend, and we all did our home test to make sure we were negative going up to it, and I think that and congratulations to my daughter, by the way. She was a beautiful bride, but I may be biased because I'm a dad.
And you're going to show those pictures tomorrow.
Well, I got to get permission to show pictures first.
You're the father of the bride.
Yeah, but I do not have permission of the bride.
So, well, congrats on that, by the way.
Thank you. But we all did the home test. The question is how good were the home tests, and there are over 400 of those approved for home use, or have, and I say approved, they have an early use authorization, and they're not all as sensitive. And some people have said that the Omicron era reduces sensitivity by about 20% of some of these tests, and so you may be 60 or 70% or 40 or 50% sensitive. In which case, yeah, that's not so good.
Are these tests at home like foolproof? Because I don't know how comfortable I feel about sticking it up my nose.
Listen,
I haven't taken a home test yet.
Let's get this right. You put it in one nostril, you swirl it one way for 15 seconds, back and forth in your nose, and you take it out, and you do it in the other one for 15 seconds, and then you take it out and you drop it in the little thing, and you just sit there and you swirl it around for like a minute or half a minute or whatever, and squeeze it out, and you drop some stuff on. You wait for 15 minutes for the result. Sounds pretty easy. It's kind of, if you can make a cake, you could do a home test.
Okay, just making sure people are doing them right and getting accurate results. Taylor, did you have other questions?
Nope, that's what I needed. Thank you.
All right, thanks. Have a good one. All right, let's bring in Dr. Brian Holmes. Good morning to you. He is medical director of the ER and lab at Memorial Health System in North Central Kansas in the town of Abilene. So glad you're with us. That's a really big title, but you always say you like to be referred to as the town's good old family doctor, which I think kind of paints that picture that you are treating your friends and your family, and you're very close to the folks that you care for. Good morning to you, Dr. Holmes. Thank you for joining us this morning. We know that staffing shortages really are affecting everyone, and I just want to find out a little bit about what you're dealing with there in your town and your hospital.
Good morning. Thanks for having me. Yeah, staffing shortages are definitely a big deal. We have the inability to do some certain procedures at our hospital right now because of that. You have the trickle-down effect of where you cannot get people moved from the higher level of care facilities that are closer to us, and then we can't get skilled patients into us because we can't get people to our nursing home because they don't have adequate staffing in order to accept more patients than they currently have.
So, can you kind of give us a day-to-day look at what things have looked like and just how they progressed, maybe just since this Omicron surge has hit?
Well, certainly we're busier. We're doing more outpatient tests for COVID. We're seeing more patients in the clinic for COVID and testing them. We're seeing a fair amount of influenza type A as well. The first week of January, our percent positivity in the hospital on COVID testing was 30%. The second week, it went up to 36%. So we're definitely seeing an increase. And we've had a few admissions as well here lately.
Are you having trouble getting people transferred out of your facility to other hospitals and hearing that might be because they're too full of COVID or you can't get ambulance crews, et cetera?
Yeah, I work here in Abilene and I also work in Junction City and at Geary Community Hospital in their emergency room, and it's horrible. We can't get people transferred from our facility, and if you admit somebody and they're an inpatient, forget it. There's no way they're going to move them. So you have to admit people OBS, but you can only do that for 48 hours. And then we've had to hold people in our emergency room for days that are on, BiPAP, on Levophed drips. I've had heart attacks. We've had to transfer, the last show I did, a guy to clear up into Wisconsin at Oshkosh. And so, and transfers in general are almost non-existent right now. We've had holds in the ER now in Salina, like 17, 30 people, and there's just no room to put anybody. And there's no ICU beds available anywhere. We've tried to call every major facility in the state at times, and there is just nothing. It's really frustrating for us. It's frustrating for the families. We also have shortages in our EMS. And I've been told several times when I worked in the emergency room in Geary that they don't have the staff to do any out-of-county transfers. Well, we're the only major hospital in the county, so if you can't go out of county, you're there. And then a lot of times they tell me that they're full, they can't take any more admissions, so you're just stuck holding people in the emergency room, and they've only got 11 beds there, 3 trauma rooms, and so it gets pretty tight sometimes trying to take care of people, and you end up with hall beds, and it's just not ideal for anybody.
Yeah, and then this is a story we're hearing across the state, both parts of the bi-state area, and I think it reflects the severity of it. And the problem isn't that we don't want to take patients. As Hawkeye said today, we have 199 patients with COVID. That's 25% of our beds are taken up by a disease that 2 years ago we didn't have, right? Mm-hmm. And you think about, well, our average census was 90 or 95% before. So what's happening to all these? Where did all the beds go? In addition, where'd all the staff go? Well, we know the staff are homesick. The patients are filling the beds. I mean, if you think if you just added 25% more patients than you've ever had, I don't know how to translate that outside of the healthcare. We all are like, holy cow, that's crazy. I don't know that it translates very well. It's like saying, okay, we got 80,000 people at Arrowhead Stadium. Now, go find room for 20,000 more people. Where are they going to go? Right? Where are they going to go?
But I think you're right. It doesn't always translate to the population when you just talk about numbers. And we always go back to that. We always seem to find a way to make it work, and we're always going to take care of you. What does that really mean? And I think people get comfortable with that, and it's hard for people to really understand
and
what that means.
It's not me, and I'm not the one suffering. I'm not the one.
Right.
The worst part is if you're in a hospital bed, they're uncomfortable, but you're going to get some food, hopefully, and you got the TV, you got something going on. But if you're in one of these hall beds, these are miserable. This is just a stretcher. We call it a bed, but let's be honest, it's a stretcher. And you're laying in the hallway and you hear people, watch people walk by. I just think that's like torture, right?
And wondering when it's going to end or where you're going to get moved to.
And you don't know where you're going. And it's not like you can pop up your television and watch it. There is no TV. Hopefully you have a computer, but you don't have any way to charge it. I mean, this is a really bad situation. And again, think about Arrowhead. If you have 80,000, I'm not trying to be diminutive here, and the little is when you think about a sporting event, but just where would you put another 20,000 fans at Arrowhead Stadium, right? Where you put another 20,000? Where would you put another 200 patients that you didn't have space for to start with? And that's what happens in that backflow at KU or at Advent or at Overland Park or at Stormont or Ascension, wherever that the folks are, when those hospitals are full, then the hospitals that you would normally get accept from, because we partly exist to serve the state of Kansas, right? That's part of our mandate. We want to do that. We should be taking 70% of transfers. That's our normal. We're taking like 17% of transfers. And that's just because we can't. There's no place to put them. And we already have people in the hallways. And so it's like, I don't have a bed at the end, and we're trying to discharge patients as rapidly as possible. As I said, our average length of stay for COVID is down, but we just have a whole lot more COVID.
Dr. Schmidtke, you sent me an email this morning with some new information that was quite alarming. Can you share that news with us since we spoke with you last Friday?
Yeah, on Twitter, the 4 hospitals that serve the Oklahoma City area put out a joint press release yesterday saying that their ICU beds are completely full, that their inpatient beds are completely full. And speaking to Dr. Stites' point, there were 107 patients on those hallway beds waiting for an inpatient bed. And so, again, what we're talking about now is a pretty scary situation where, if there's a car accident or if there's a heart attack or a stroke, we know that minutes count in those cases. And so any delays in getting care could possibly complicate the outcome for those patients. But again, there's a lot of patients that are in that limbo zone. It's not just 1 or 2 in Oklahoma City. It's as much as 107 people.
Yeah, and unfortunately, I don't think that's unusual. I think that's true in a lot of areas, and some people are saying, some people are not. I read that press release from Oklahoma, and that's a tough thing. But I'll tell you, it's true. I mean, ask the folks in Abilene, Kansas. I think they'd give you the same press release.
I was going to say it's pretty darn close to home. I'm going to ask Dr. Holmes one quick question because I'd like you to comment, Dr. Stites, and then I'm going to let you go. I promise.
Okay. Yes, ma'am.
Dr. Holmes, the declaration from the governor. Are you starting to feel any of those positive effects? Do you anticipate feeling those?
I hope it helps. I don't know that we've seen a huge change yet. We just live in a smaller, population density, and so you have finite resources. And so just because you have a declaration of emergency, it doesn't mean that all of a sudden there's more people to work with. We offer $6,000 bonus for CNAs, $15,000 for nurses, and we're not getting applicants. And those numbers are just kind of crazy, but we're in a mess. I think we're close to crisis standards of care, really. I don't know what it's going to take for the governor or whoever has to declare that, but when you can't transfer, when you are doing things that you normally don't do in your facility, like sending out a heart attack in your emergency room to go get a heart cath, gets a stent, and comes back to recover in your emergency room, those are just very unusual things, and our staff aren't used to doing that. We're having patients with 2 cardiac drips on our floor for AFib, and just stuff that is unusual we would never do before this.
Dr. Stites, an emergency declaration. We think that
Yeah,
staff and help are going to come falling from the sky.
We wish that were true. But the reality is that exactly as he's described, that the governor's declaration has helped in some ways, for sure. I mean, we're able to use medical students and bring back retirees, and you don't always have to have licensed personnel doing swabs. So that's a good step, right? That is a good step. The challenge we have is that inside of our brains, we haven't transitioned to crisis standards of care because people don't wear masks, and that's from our perspective, that's the way out of this. That's why you see the school districts started to put mask mandates in place, because they don't have enough people to teach the kids. Now the kids can't go to school, and we're back to what Hawkeye, we predicted this 60 days ago, or if not even yesterday. We said, look, if you don't put masks on, your schools aren't going to stay open, your business won't stay open, because Omicron's so darn transmissible. And I think what we're seeing is exactly that. It doesn't mean we're brilliant. It just means we were stating the obvious. And what folks have to do is to come around to the obvious with the clear answer. The rules of infection prevention and control still travel with us. They still take care of us right up into this moment and every day going forward. If you keep your distance, wear a mask, don't go out and you're sick, and get vaccinated, we can win this thing. But as long as we try to flaunt the rules and act like they aren't real, we're going to end up hurting you. You're going to end up getting hurt, and not with intentionality, but with as a byproduct of not having enough folks and not having enough beds. The American healthcare system's not built for a 600% or 500% increase in the number of Omicron cases that we're seeing right now, and nor is any system across the world. So we are all struggling with the same beast, and this beast, and we're all tired of it, is the pandemic, which has slowly become endemic. And then there are folks saying, gosh, well, let's just all go get Omicron so that we can get host immunity and we're protected forever. Well, you're protected for a few months. You don't know about the next variant. And the best thing to do is just what we keep saying. If you just put on a mask and get vaccinated, you can help reduce the burden of disease and we can get through this okay. Otherwise, we will be and are in multiple areas of the country making choices about who lives and who dies, because the crisis standard of care allows you to do that when you don't have enough resources or you don't have enough people to take care of all of the folks who come to your door. When you can't do that, you have to make a decision about who's going to live and who's not, and who you're going to take care of and who you can't. And that's the crisis standard of care. Again, we're not there right now today, but you can see if the numbers continue to rise that we will veer into this area, much as Oklahoma City is doing right now.
I will let that be your final thought, because I
Okay.
know you've got patients
Wear a
waiting for
mask,
you.
people.
All right,
All right, I'll be
do
back
it. All
tomorrow.
right, thank you. We will see you tomorrow for
Yes,
open
ma'am.
mics.
Open mics.
Yep.
Guess what we're going to talk about?
I'll let you
Rules of infection control, crisis standards care, and making sure you just do the right thing.
Mayor Lucas is going to be
And
joining
Mayor
you as well.
Lucas is going to join us, and we're all going and we're going to talk about masking.
Okay, let's do it.
VIP.
We will do it. Okay, I have a couple more questions. We've written some good questions from our community. Dr. Amber Schmidtke, I have to ask you, how is your son doing?
Yeah, thank you for asking. So he got sick with COVID last Monday, so a week ago yesterday. We tested him by antigen test on Tuesday, and he was weekly positive. We confirmed that with a PCR test the next day, and he said he was screening positive. So he must have had a very low CT value on that PCR test. In any case, his symptoms thankfully were mild and manageable at home. They were, a cough, a sore throat, congestion. He's getting much better, and to the point where yesterday we started allowing him back with the rest of us in the house, and provided that we were all wearing masks, we had windows open. It was a warmer day, so we could do that. And so far, the rest of us have managed to stay COVID-free. We're all fully vaccinated. 3 of us are boosted. And I gotta say, I think that the vaccine has been a big part of why his symptoms were as mild as they were.
I was going to ask you to give us some good advice on how to manage a family dealing with COVID at home. I think you just said it. Everyone's vaccinated. You're leaving windows open when you can. You're masking. Any other advice you might have for folks? We've got a lot of families dealing with this. One person gets it, and it affects everyone. What can you tell us?
Well, when you're the son of a microbiologist, there's going to be different standards inside that house when there's an infection. And so for us, what we did was we had him isolate in his bedroom. We had a HEPA filter running inside his room. We were bringing meals to him. Grandparents were FaceTiming with him constantly to keep his spirits up. He was communicating with his fellow students in Google Classroom. And we FaceTimed him in for meals. We tried to keep things as social as we could, but with distance. And like I said, we've so far been able to manage keeping everybody else healthy. Because again, if the parents get sick, as many parents know, then it's really hard for the family to continue to be successful. So for us, that was what we chose to do, and it has worked out okay. We're really excited that he's back with us again, that we're able to, be with him and watch TV with him and those sorts of things.
Okay, good advice from the microbiologist. I think you've raised the bar on how we should do it, so I think that's great advice. Thank you. But you touched on something, and just because you're a mom, and I know you've got young kids, and you guys have been doing it right, I just, with this news that everyone's waking up to, where now not only kids are out of school, they're not even virtually learning. I mean, because now you don't even have teachers to teach virtually online because people are sick. Just what do you make of that? What does that also just tell us on a, when we're predicting, and what does that tell us with numbers? What does that tell you?
Well, I think what it points to is that, we can, I think I said this on Friday, we can pretend that Omicron is mild, and thankfully it is milder than some of the other variants that we've seen, but it is very disruptive because of how many people it can infect. And, we can pretend that it doesn't matter, but the reality is that this matters a whole lot. You can see the disruption that's happening, and it's making it very hard to keep things going the way that we would want to. I think that, on the one hand, schools had a choice about instituting COVID mitigation strategies. Some schools did, some schools didn't. And now we find ourselves in a position where a lot of schools are having to make really tough choices about either virtual learning or no learning at all. And so again, we have a choice in a situation like this that has a lot of chaos. We either manage that chaos to the extent that we can, or we let things rip as they are, and the virus controls the whole situation for us.
Yeah, you mentioned your son and trying to keep him connected while he was infected. It just made me think, I think one thing we've all agreed upon during all of this pandemic is that kids need to be in school. Kids need to have meals. They need to have that social interaction and people looking after them. So it's getting to a heartbreaking scenario there with the schools. So stick around. We've got some viewer questions coming in, so I want to get to those. And I want to start with Dr. Holmes. We've got a few for you today. So question is, if you have a transfer, Allison is curious, Dr. Holmes, if you have to transfer someone from Abilene to somewhere as far away as maybe Wisconsin, are you then able to transport them back home if they survive? What does the transfer back look like for someone who may have to be transferred far away?
Well, that's difficult. You have to be able to somehow arrange that. They have to be well enough to travel. A lot of these people who they may get out of the ICU and off the ventilator, but then it takes quite a while to get well enough to take care of themselves and be able to get in a vehicle and get back home. Unfortunately, I know the one that went to Wisconsin passed. We've had other folks who've gone to Oklahoma who don't make it home, except they're deceased. So it's difficult.
So oftentimes the farther they're having to go, maybe the more severe they are. Is that what you're saying?
No, it's not always how severe they are. It's a matter of availability. We would never, ever transfer somebody to Wisconsin if we don't have to. That's just a matter of you start making phone calls and find a place that is able to accept the patient. And unfortunately, a lot of times it is out of state. But even here recently, some states are saying no out-of-state transfers at all, and it's just impossible really to adequately take care of everybody in this pandemic.
So a follow-up to that question was, if you do have to transfer somebody out of state far away, how does that conversation go down with, especially if you have somebody who's intubated, how does that conversation go down maybe perhaps with the families to take them that far away from home?
Well, you just have to let the family know that these are the resources available, and they'll either say yay or nay of out-of-state transfer. They understand it's going to be a hardship on them as far as ability to get to see their loved one and be a part of their care there. But as you know, a lot of the policies in different hospitals are that you can't visit anyway on a COVID-positive patient. But it's definitely difficult on them.
Dr. Hawkinson, Ashley's curious, can you touch base on GI COVID symptoms? She says she has a friend in the hospital with gastrointestinal symptoms instead of the typical respiratory symptoms. She feels it doesn't really get talked about. Can you talk about that?
Yeah, it's just some other of the, it's not as prominent, but we know GI symptoms or gastrointestinal symptoms have been present and discussed since early on in the pandemic. We understood that those receptors that the virus binds to are in your GI system as well, and people can have some nausea, maybe some vomiting, some diarrhea, but again, not as typical or not in the same predominance as those other respiratory symptoms that we typically think about with the cough, the shortness of breath, maybe a decrease in the smell, and also fever. But we know that can occur. Generally, it's probably not the only symptoms that they have, but certainly it can be. We know, again, that the gastrointestinal organs do have those receptors, so the virus is able to infect that area. And we also know, again, from our wastewater that we can detect the virus in the wastewater. So obviously, you are able to get it through the GI system and to expel it through the GI system as well.
Okay, Isaac has a question about masking. I'm going to come out to Dr. Schmidtke here in just a moment, but Dr. Hawkinson, I'm going to start with you on this one. Is a cloth mask over a surgical mask as effective as an N95?
Yeah, so what we've said, before is we know early on from the pandemic that certain masks do offer different levels of protection, with the N95 being the highest, the surgical masks being a little bit lower than that, and of course the cloth mask. And when we talk about cloth masks, it is usually that 2 or 3 layered woven cloth mask. We know the CDC just recently came out with some updated guidance on masks, saying that just exactly that the N95s do provide more protection. However, they also talk that important as that is, it's also very important to make sure you have a snug fit and a good fit around the nose and the sides of the mouth and under the chin of those masks, whether it be an N95, a surgical mask, or a cloth mask. We know that in the CDC recommendations, they do, if you do double masks, the only really recommended one, because the data is there, is that cloth mask over the surgical mask. So that is a reasonable thing to do.
But I do love what you always say, which is a mask is better than no mask. So.
And the CDC did say that too. Obviously, we know there are, again, there are different filtration and protection values associated with those different masks, but still any mask really is better than nothing.
Dr. Schmidtke, I know you're a big fan of the N95s. Your comments this morning.
Yeah, no, I echo everything that Dr. Hawkinson just said, and he's right. The CDC came out with better guidance when it comes to what's going on with the masks. I think when it comes to double masking, something that I have found is sometimes putting that second mask on disrupts the fit of the mask that's closest to my face. So in those instances, I'm better served to just wear the original mask that I'm wearing closest to my face. And so you may feel like that's an extra layer of protection, but you're not invincible. And the biggest risk, of course, is to have those gaps around your face, around your nose and mouth. And so, again, I really encourage people to try to upgrade their mask if they're financially able to do so. A place that I really like for finding authentic KN95s and N95 masks is Project N5 or projectn95.org. These are vetted because there's a lot of counterfeits out there, unfortunately, and people trying to make money using faulty masks. And so I really encourage going through a reputable source like that.
I have a question. Jared has a question, and I'd like anyone to jump in and just comment. First of all, thank you for all that you do. How do you all remain compassionate to those unvaccinated? It has to be super frustrating for you. Don't all talk at once.
I'll let them go.
Okay. So, Dr. Holmes, and then I do have a good follow-up question for one of our viewers kind of along this lines, but just what are your thoughts about that? You must hear that a lot. I know we do get that question here.
Yeah, you get extremely frustrated. One of the first triage questions I ask are you vaccinated or have you had COVID? And, most of the people that we see that are really ill are not vaccinated for whatever reason. And you're frustrated at the volume of it because those are the folks that are really going to get sick. But in the end, we still have to treat them like we would anybody else because, maybe there's a really good reason they can't get vaccinated. I did have a guy the other day who admitted he had Guillain-Barré with the flu vaccine. He didn't feel comfortable getting any other vaccines since then. And I can understand that.
Dr. Schmidtke, frustration when you're running those numbers?
Yeah, so I obviously don't have the lived experience that the doctors on the call do today in terms of seeing these patients up close and personal, but I do get to see the numbers and I do get to see the strain that it's causing. And when we think, one of the things that you're hearing a lot about is, well, we can't keep closing schools because of the decisions of the unvaccinated. And on a certain level, I understand that sentiment, but we're also not doing anything else to limit the extent that the unvaccinated are, bringing COVID into our communities. We aren't closing bars and restaurants. We aren't requiring vaccinations for admission to certain things. And so we can't have our cake and eat it too. So there's a lived experience that the physicians on this call are experiencing, of course, and there's a societal cost that we're seeing as well. So definitely I feel the frustration. I think a lot of us would really love to be further along in this pandemic than we are. However, at the end of the day, these are people that are hurt and suffering. And I think we need to have that compassion because people are trying to do the best they can in a situation where they are scared and maybe not as well informed as they might want to be. And so I think we can all relate to somebody in that position. And I would encourage people to continue to have that compassion.
Dr. Hawkinson, almost 2 years in, what's your frustration level? And to Dr. Holmes' point, yes, there are other reasons why people can't get vaccinated. We know that. But that aside.
I mean, there is frustration when you're dealing with an individual patient. It's not a lack of compassion. It's a frustration that a lot of this could have been prevented, especially when you're talking about those people that are in their 30s, 40s, 50s who are otherwise healthy, who are unvaccinated, but are now in the hospital or dying, have families at home. this could have been prevented. So it's a frustration because we do understand the tragedy that they are going through, that their family is going through, that we do know and understand this could have been prevented. It's not necessarily for spread of the disease in the community or an infection or a case, because we know the vaccines were created to help prevent hospitalization, severe disease, and death. We know that they continue to do that very well. And so it's more on the individual level when I do see those patients in the hospital who are otherwise healthy, who then who I now know and understand that this really would have been prevented, this hospitalization, if they would have been vaccinated and been able to save a lot of this illness and this tragedy for them. So it's more frustration, and it's still compassion, because I understand the troubles that they are going through and their family is going through with them.
Couple more questions. Jennifer has one, Dr. Holmes, specifically for you. She says, it's my impression, though I could be wrong, that rural Kansas communities have not taken COVID as seriously throughout this pandemic. Could you just give her some perspective, or maybe just kind of take her along for the ride from where maybe we began in the beginning of the pandemic to where we are today? Has that changed their perspective?
Well, unfortunately, until a lot of these folks have a close relative or loved one that ends up suffering from COVID or dying, they just aren't buying into it still. We have a lot of folks that are very independent here and have their own mindset. They have their own resources of information that are different than what I use. And sometimes there's just no reasoning with them. A lot of them are bought into ivermectin, and some people are actively taking it. They all have their backup supply of ivermectin. It's frustrating to talk to them about vaccine when they won't listen. Their heels are entrenched.
That must be very frustrating for you. So you're still trying to get people vaccinated?
Oh yeah, we only have I think the last time I talked to you guys, last fall, we were at 52%. We're at 54% now for our county, which is not a big bump. But, all we can do is talk about it, recommend it, see if we can get people to buy in. And I don't miss an opportunity to try to talk to people about it, that's for sure.
Yeah, I bet not. Isaac has a question, Dr. Hawkinson, and then I'll ask Dr. Schmidtke just your thoughts on contact tracing. Any comments on the Kansas Department of Health stopping contact tracing due to the numbers just being too high? Mm-hmm. Just your thoughts on that, and what does that mean? Dr. Hawkinson, I'll start with you.
Yeah, I mean, my initial, again, we know the spread is out there. We know when you do go to those gatherings, and we heard Dr. Schmidtke talk last week about that, and there is that good, I think it was the Georgia Tech, the risk factor site, looking at in your county, if you were going to a gathering, how many people would you expect to have COVID, depending on how many people were going to be there. Overall, again, we know the prevalence of the disease in the community. A lot of people are just calling their friends if they know that they were exposed or have it and letting them know. Contact tracing is very difficult. We know that overall workforces are short right now, in short supply, and we know that the disease prevalence is high. I don't necessarily see a problem with that. We also know a lot of institutions are doing their own type of contact tracing, such as schools and things like that. So I think I don't have a problem with KDHE not necessarily doing that.
So Dr. Schmidtke, how does contact tracing or taking that away skew the numbers? Certainly it was a big deal when this pandemic first hit. That's something we talked about. That was part of the process when somebody got COVID. It's got away. Thoughts?
So, on the one hand, contact tracing is great for notifying people that they were exposed, getting them early access to a test, trying to identify their cases early in the progression before they get more serious. Because the earlier you really treat this thing aggressively, the better the outcomes may be. When we lose that, there's a lot of people that are walking around unaware that they're unexposed or that they were exposed. And so one thing that I've really been encouraging the people that I speak with is to keep their own log of who they've been interacting with, especially unmasked, over the last week or so. And to be prepared to do your own contact tracing. Do not be embarrassed of the fact that you've caught COVID if that happens to you. It is really everywhere right now and very hard to avoid. But because you love those people, because you respect those people enough to spend time with them, I I think it's in your interest to make sure that they know if you got sick that they were exposed, so that they can take the actions that they need to keep themselves healthy, their families healthy, et cetera, et cetera. So, in lieu of robust contact tracing, which has been an issue since the start of the pandemic, every time that we have these surges, it's really it becomes our responsibility to do some of that contact tracing on our own.
I'm so glad you brought that up, because Dr. Hawkinson and I we were just kind of talking about that, just kind of taking it upon yourself. Do your own contact tracing. And I've more and more over the last several weeks received text messages from moms that kind of has 6 degrees of separation from some kid in a class that has a parent or a grandparent that they may have been in contact with. And then we sit there and kind of navigate if we think it's safe, or if kids should play outside, or, mask on a play date, or all those kind of things. So, but I think that's right. Do your own contact tracing, and don't be afraid to share that. Oops, I may have come in contact, but I want to make sure you're staying safe. So thank you for bringing that up. I do want to get to some final thoughts today, and I want to start with our good old family doctor, Dr. Holmes, out there in Abilene, Kansas. So just kind of what's your final thoughts? What do you want our folks to know as we head out into the week this week? Just what is your advice and what are your thoughts?
Well, I want to first of all, thank you for letting me be on the program, and really appreciate all the work that your team does. And I think it goes a long way to helping us get through this. Final thoughts would be, please wear a mask. Think about other people. This isn't just about yourself and your own disease. If you get it, there's lots of folks out there that I see at the grocery store walking around that I know are immune compromised or have cancer. And I see all these people around them without a mask on, and it just drives me crazy. But if, get vaccinated, wear your mask, try to protect each other, encourage students in school, even if it's not recommended or not required, that you please wear a mask in school, because you just don't know who you're going to be sitting next to and exposed to. So just try to keep battling through this. Hopefully the end is close.
Well, thank you for fighting the hard fight out there, and caring for our folks out in Western Kansas and our rural communities. Thank you for serving others, Doctor. Appreciate it. And yes, you're welcome back any old time. Dr. Amber Schmidtke, thanks for being with us today. Always good to have you. Your final thoughts.
I think really it's a lot of what Dr. Holmes was just saying. Everybody needs to be making good choices right now. I think a lot of people have put COVID-19 in the rearview mirror, but it is right here in front of us. It's important for us to continue to take action to limit disease transmission for the benefit of our communities. You never know, like Dr. Holmes was saying, what somebody else's health condition might be as you're walking past them in the grocery store. You don't know who has an aging or immunocompromised relative at home, and they're fighting really hard to protect those people. You don't know who may have a pregnant mom at home when you're in the schools. And so I would just, again, encourage people not just to have compassion about COVID, but compassion about everybody. Everybody is dealing with a really stressful situation right now, whether it's your school teacher or the grocery clerk or other people. And so I think it's important for us to remember that at the end of the day, we're all people trying to make good decisions. We just need to encourage people to make more good decisions when it comes to COVID-19.
I love that. Compassion. That is the word of the day, word of the week. Thank you, Dr. Schmidtke. Dr. Hawkinson, your final thoughts today.
Yeah, I would just echo our guests. It's important to continue those things we've talked about. Vaccination, doing those other pillars of infection prevention, masking, distancing, hand hygiene, understanding those circumstances that you're going into. We still have quite a few more weeks of this cold weather, and so I know a lot of gatherings will be happening indoors, but if you can be conscious about those situations, and if you have to hold back this year for a few weeks, that may be reasonable.
All right. Thank you all for being with us today. Don't forget, you can catch our shows anytime on Facebook and on YouTube. Tomorrow, it's Open Mics with Dr. Stites. He is back. He is one-on-one with Kansas City Mayor Quinton Lucas. Well, he's going to discuss his own bout with COVID and the impact it had on his family, including his little 8-month-old baby. His message for us, plus what he is doing to help stop the spread of COVID in his city. As we leave you this morning, we're going to leave you with some answers to questions that we get a lot. So here is Dr. Dana Hawkinson with how you can care for COVID at home.
Rest. It's hydration and taking in fluids. Water is probably the best. Also nutrition, making sure that you're eating, keeping your nutrition up. If you need some medicine for fever or aches, Certainly you can take some Tylenol and ibuprofen as directed to be able to help reduce some of those symptoms. Remember to isolate. If you can try and isolate to help prevent the spread to other people, especially in your household, that's going to be the best thing you can do. If you aren't able to isolate very well, then certainly using a mask in that household is going to be vitally important. Really, after about 5 days, you can get out of isolation. But if you are going to be around other people, you need to continue to wear that mask for 10 days. They don't always get sick like humans, but we know that we are able to spread it to those animals, especially those household animals like cats and dogs. So I think the recommendation is really to try and isolate away from them as well.
Subscribe to our morning medical update and open mics with Dr. Stites podcasts. Now everywhere podcasts are available.